Clare Stradling, HIV dietitian from Birmingham HIV Heartlands service. People with HIV don't really need a particularly different diet to the normal general population, and the issues that people with HIV face are very much similar to the rest of the population, and it's primarily because as a British nation we're getting fatter and we're more at risk of diabetes, we're more at risk of heart disease, and the HIV population are no exception to this. And in fact, with the HIV infection itself and the antiretroviral drugs, people with HIV are at higher risk of heart disease and so probably need to be a bit more careful than the general population. And that's not just the case with diet, but the whole lifestyle. So it means not smoking, taking exercise, generally looking after yourself, having plenty of sleep, and then watching your diet as well and eating healthily so that you can avoid having a heart attack and developing diabetes and developing a fatty liver, which is also becoming more common in both the HIV population and the general population. A lot of people will develop a fatty liver, and that can go on to progress to liver disease. Now, at the moment we're not really sure which people will progress to end-stage liver disease and which people won't. Some people may progress in 5–10 years, other people maybe 30 years, other people maybe not at all. The research around that area is quite vague. It's very common for people to have high cholesterol, and specifically high LDL or low density lipoprotein, which is the bad cholesterol, and it's the cholesterol that clogs up your arteries, so it forms plaques in your arteries and narrows them so that the blood can't go through. This becomes dangerous if the artery that's being narrowed is the one going to your heart, because then if it stops the blood flow to the heart, it causes a heart attack. So if you have a high LDL or high cholesterol, the chances are your arteries are being reduced or narrowed, and you're more likely to have a heart attack. Now, the way to reduce that narrowing, so to make your arteries wider and to get rid of the plaques, is to reduce your blood cholesterol. And how you can reduce your blood cholesterol or your LDL is by following a low saturated fat diet. So it means changing the types of fats that you eat, and changing other aspects of your diet as well. Traditionally, we've been very focused on fats and following a low saturated fat diet, which would involve reducing the amount of meat and meat products. So whether that is cutting the fat off meat, eating less beef and lamb, and eating more white meats and chicken and beans and pulses, or whether it's as food products like meat pies and anything that's been manufactured tends to have more saturated fat. Those are the kind of things that we look at with reducing saturated fat. But due to recent research, we are now focusing more on changing the type of fat. So instead of just reducing the animal fats, we are looking at increasing the polyunsaturated fatty acids and the monounsaturated fatty acids, which are abbreviated to MUFFs and PUFFs. And if you tip your margarine upside down and have a look at the label on the bottom, you'll notice that it's all broken down into total fat, saturates, polyunsaturates, monounsaturates, and you can see how much of each is in your margarine or your butter or whatever you're buying. So your polyunsaturates and your monounsaturates are both found primarily in plant foods. So if you're eating a balanced diet, good variety of things, you will be getting your monounsaturates and your polyunsaturates, and you can also choose margarines that are higher in those, and foods, even for example if you're buying oven chips or crisps, which you traditionally see as unhealthy and fatty, yes, they may be high fat, but if you buy the ones that have been cooked in olive oil or sunflower oil, then their monounsaturated or polyunsaturated levels will be higher, and therefore they will be better for you. When people are starting antiretrovirals, one of the issues people say is they don't really like taking drugs on an empty stomach. I think it's just the thought of having tablets going down on an empty stomach. The first thing you need to do is check what the requirements of your particular drugs are. So you'll be on 3 drugs and you'll need to know, do they have to be taken on an empty stomach, do they have to be taken with food, or does it not matter? Once you've checked that out, you can then decide the best way forward. But most people will either take them first thing in the morning just with a glass of water or something, or they will feel more comfortable taking it after a meal when they've had something to eat. So check with your pharmacist if there's any special requirements for the drugs that you're on. But if you're the kind of person who feels that you'd rather have something to eat with your tablets so that your drugs are going with something else into the stomach, then just a snack would be fine. If you struggle eating first thing in the morning, something like a banana or even half a slice of toast would be sufficient. When people are starting antiretrovirals, it's quite common to get symptoms at the beginning which will then go away, and it's worth persevering in those first couple of weeks when you're feeling nauseous or you get a bit of diarrhoea, because 9 times out of 10, if you push through and keep going, then the symptoms will go and you'll then have 5 years absolutely fine on those drugs. So it's worth hanging in there for the first couple of weeks. If you are having problems, then please do phone up your clinic, speak to your clinical nurse specialist or your dietitian or your pharmacist, and ask for some extra help. It may be that you need some antiemetics to stop you feeling nauseous, or you need some antidiarrheals to stop the diarrhoea to get you through that first phase. Diet-wise, there are some things that can help. So if you're having nausea, it kind of seems back to front, but it is actually better to have something in your stomach. Although you're feeling sick, it will be better to eat something before you have your tablets, even if it's just a bit of toast, some dry crackers, something quite plain, a carbohydrate type food, so bread or cereals. So you just got something will help the nausea. Some people find herbal teas or mint teas helpful in relieving nausea, or just sucking on mints can be quite helpful. Or ginger, so whether it's sucking bits of crystallised ginger or a ginger tea, that can sometimes be helpful with nausea. The best person to ask for tips is any pregnant woman. They'll have 100 tips up their sleeve on how to avoid nausea.